welcome to Side Streets and Intersections on IntellectualRadio.com. I am your host, Angela Champ, and here with me in the studio is a friend, a professional, and she's doing some big things in the health field. Her name is Camila. She's so flawless. I'm sorry, James. I just thought I would say it and make her laugh a little bit. She said she's a little nervous, even though she speaks all the time at different forms and everything. So welcome to the studio. I'm glad that you could take some time out of your busy schedule.
Thank you for having me.
So before we get started, let me just send a couple of reminders on some community events that's going on. On October 21st, I will be hosting my first event to honor you at Durban's Bar and Grill. It's my first event. Food is on me, and if you get there early, drinks will be on me. Well, don't everybody come at once. However, we should have a good time. Reminder that this is an iHeart event, IntellectualRadio.com and Side Street Intersection event. And also, let me just say, on October 29th, I will be attending the Divas Inc. Pretty in Pink affair. My childhood friends, Vicky Travis Woods and Madeline Ward Freeman. They're doing some awesome things in the community to raise awareness regarding cancer. So if you have not gotten your ticket, please get your ticket. This is an event that you will not want to miss. Also, if you are looking for an opportunity to explore your hosting your own show, please do not hesitate to call 708-223-8953. Now that we've gotten, taken care of the preliminary things, we can get started with this show. So, Ms. James.
Yes.
So, tell the people a little about who you are and what you do and what got you into healthcare.
Okay. As Angela mentioned, I'm Camelia James. I'm a certified and licensed physician assistant. For those of you all who are not aware of what a physician assistant is, I am a licensed healthcare practitioner who collaborates with the physician and giving medical care to patients. I have my own core of patients in which I see. My specialty is adult internal medicine. I also have a specialty in women's health as well as geriatrics. Currently, I am working, again, adult internal medicine with a specialty with geriatrics.
Okay. And so, but let me also say this, I'm really big on highlighting people that come from the west side, be it the western suburbs or the inner city, particularly focusing on the good things that we are doing, because the media in recent time, it highlights all of the negative things. And so I like to highlight those people that are making an impact to our community to make it better. You also are a graduate of Marquette University, am I not correct?
Yes.
And your education is in what?
My undergrad studies was in Alabama in biomedical science, and I have my master's in physician assistant studies from Marquette.
So you're pretty smart then, is what?
Well, I would like to believe so.
So let me ask you this, just so for our iHeart listeners, our Facebook listeners and watchers, IntellectualRadio.com, as well as Side Streets and Intersections. She and we met, I want to say back in 2011, 2012, may have been a little earlier than that. And I was actually a patient of hers. And one thing I can say, and I appreciate, she always kept the professional side very professional. She never interlapped the two. And a friendship developed. And, we got a chance to travel and do some things and hang out. And we lost contact for a little bit, but we're back in contact. And so I just like to highlight friendships, because those things are very, very, very important. And I think that so often during the course of our lives, we move forward. And it's important to keep those relationships intact, because We just never know. As big as the world is, it really is a small knit.
Mhm.
So getting back to what you do, what made you interested in medicine?
Ever since I can remember, I've always just had a passion for medicine. My mother is also in the medical field. She's a registered nurse. And I think being around her and watching her and hearing her talk so passionately about her care for her patients, far as I can recall, I've never wanted to really truly go into any other career but medicine. I initially wanted to become an MD, but then in my junior year of high school, I got introduced to the physician assistant field by way of my mother as well, because it was growing at the Mount Sinai Hospital that she was currently working at the time. She was running into a lot of physician assistants, inquired about it. And she presented to me and she said, this could possibly be another avenue if you weren't sure if you want to go the full many years that you would need to go for MD. This is half the time, and you're still a licensed practitioner practicing medicine. So I looked into it. I had not made a decision right away. I looked into it, but by the end of my senior year, after researching a little bit more, I felt that it could be something for me because, again, the passion for medicine was still there. It was just how I wanted to go about doing it. So I knew I wanted to practice medicine. And it's a blessing. It's a joy. I would not change anything for the world. I get asked all the time, would I consider going on to become an MD? A lot of my patients, they feel as though I do, if not the same, actually more than those of MDs that they have ran across. The time that I spend with them, the bedside manner, which I explained to them that some of those things you can't be taught. It just comes from you innately. We're taught medicine, but you're not taught bedside manner. That just comes from each individual and their care or lack of care for what they do and for the patients. But I tell them all the time that, I mean, there are programs where I can go easily from physician assistant to MD, but at this point in time, I have a lot of flexibility, which is one of the things that I wanted when I went into my field. And then, doing my rotations, clinicals, working in hospitals, all different settings, surgery, pediatrics, emergency room. I recognize that it's real easy when you're in medicine and practicing for that to become your entire life. And you look up and time have passed and you haven't really done much of anything else because you're so focused on the your career, which is a great thing. But I always said I wanted balance in my life, which is part of the reason why I did decide to go into the physician assistant field, because it gives me flexibility, at the same time allows me to do other things that I enjoy. I have passion for music as well, so it gives me the freedom to still be able to do what I love, to acquire the things that I like to acquire, to, of course, financially, that's why people work as well, because you want financial stability. So it provides that as well. And then also, like I said, the flexibility. So to why I went into this is basically because for my love, the passion, and also the flexibility that it gives me within the rest of my life.
So, with working in the African, I'm sure you have a very diverse group of patients that you see. I know this from personal experience, being a patient of yours at some point in my life. But particularly in the African American community, what are some of the things that are highlighted, particularly with African Americans, that we need to be more attentive to when it comes to our health that we seem to overlook?
Well, one of the things that we have to understand is that non-Hispanic whites, um, which leaves African Americans, Hispanics, and then you had throw in Mediterranean cultures and of those, but of all of the other cultures outside of non-Hispanic whites are deemed as um, a disadvantage when it comes to our health. And the largest reason that I see, just working also in the inner city, in which is the area in which I pretty much work now, is just the lack of knowledge and understanding. I think because, as we know, there are totem poles that society ranks cultures, and it's not unusual to hear that African Americans kind of fall towards the bottom. So, with that being said, there is also a lack of awareness, a lack of understanding, a lack of education. The socioeconomic status is just not the best, which plays a role in what's available to the community. Clinics, doctor's offices, um, other different areas that people may go seek out information. It's just not there. So there is a lack of awareness in regards to healthcare. Um, I find that most African American, which is probably about at this point 85% of my patient load, is they are becoming aware that high blood pressure exists, high cholesterol exists, heart disease, strokes, cancer, etc. They recognize that these things exist, but the connection between themselves and these disease processes, because there isn't an awareness of what I need to do in order to go about where I can reduce my risk factor, it's just not there. So it takes healthcare providers like myself who go into the community, because I think most times, most doctors, healthcare providers, they sit in their office and you just kind of get accustomed to, which I did office setting for quite some time, which you just kind of, patients come to you, you're in a comfortable setting and you deliver your medical care, but it's different when you're going into their community. Because currently I'm doing home health medicine. So you're going into their community, and that's where you really truly see the the living quarters. You see in their community where there probably isn't a lot of outreach and a lot of clinics, healthcare offices where they can go if they do. Most people, if they are feeling sick, they'll find the nearest emergency room, the nearest hospital. But as we know, when you go to emergency room or hospital, they're just there to treat the acute problem, and then they send you home, and they
Absolutely.
expect you to follow up with your primary care doctor, who is going to be or should be the one to educate you on how to prevent that from happening again.
So let me ask you this. With the, I want to say maybe the impediment of managed care, while it does serve a purpose, we know that the bottom line is financial. How does that impact the type of care that you are able to employ?
Well, of course, there's hundreds of different healthcare plans out there. Some of the larger ones that most people are familiar with is, Medicare, Medicaid, Blue Cross Blue Shield, AARP, Humana, some of these larger ones. But within those larger umbrella plans, you have, hundreds of different smaller plans. And because there is a large cutback with what these insurances are wanting to cover, you do find it, because now a lot of the healthcare plans that a lot of patients are going into is cheaper on their pocket, but it can limit their care, or you have to go through their insurance plan to get approval, and that's if they decide to approve it. And you can go about the care that they may have chosen not to cover, but it's an out-of-pocket expense.
So let me just stop you. You said something that I found it was eyebrow raising. And I think that so often that's where a lot of the miseducation comes from in terms of the higher anarchy that puts out this information. They'll tell you about how cheap the cost is, but they don't tell you what you're actually giving up.
Mm-hmm.
And so, for example, take a person who has breast cancer. Well, we know that that may require years of treatment, many treatments, and many types of treatments. However, they may have coverage that says simply you're covered for 100,000 when the cost in and of itself may be 500,000.
Mm-hmm.
So that means that the patient, while they're excited about having this card, they're not really covered. Am I not correct?
Yes, well, again, the example you gave, you're covered up to you can be covered to a certain extent depending upon your plan and your coverage. But as you said, beyond that is where you do find people having to take out second mortgages on their home. You have people who go bankrupt. You have people who have to now decide if they're going to eat or treat themselves. So as drastic as it may sound, but the truth of the matter is, it's because the bills begin to pile up and pile up, and people are doing the best that they can to try to cover the bills. But anybody who may have been in a situation when it seems like every day a bill is coming, it seems like you never can catch up. So medical bills can definitely do the same thing. That's why it is really important to research. I try to teach my patients or the family members who may be helping them choose a plan. I tell them always research the plan, and because anyone can make anything sound good. For example, just real briefly, I had a patient actually last week. Um, she was not able to get any of her blood pressure medication. And when I asked her how come, she then told me that she wasn't sure why. She's an 80-year-old patient. So come to find out, some lady came to her building and convinced her that the plan that she had, which covered all her medications, she didn't need that plan and switched her into a different plan. So the plan she switched her into doesn't have a drug plan coverage.
Wow.
So now all her medications have to come out of her pocket.
Wow.
And when I called the pharmacy and to inquire why all of a sudden now she can't get her blood pressure medicine, because she's been without it, her blood pressure was through the roof.
Wow.
And that's when the pharmacist ran her insurance and said, oh, they said she no longer has that insurance plan, which was a drug coverage. She got switched out. Come to find out, the patient not being aware, not understanding. Of course, somebody tells you something that makes it sound good, or it may cover one thing that you've been looking for, but again, they didn't tell you this is what it's going to eliminate. And so now we got to go through trying to disenroll her from that one to put her back into original plan so she won't have to keep paying out of her pocket. As you know, an 80-year-old person is on fixed income.
Absolutely.
So besides the other bills they have to pay, now they got to pay for their medication out of their pocket. So it's just an example to show how when you don't know or understand or have, especially I would say this to individuals who have elderly family members or friends, it's good to try to encourage them to allow you to help them when it comes to enrolling in different insurance plans, because it's a lot of medical jargon that they're not going to understand. I mean, most of 40, 50-year-old may not understand if they don't know medicine. So now you tack it on another additional 40 years, 80-year-old person is not going to know.
Absolutely.
So it's good to be involved if they allow you to, especially if if you have a mother, father, grandmother, to allow them to help them to become more aware of what it is that they're looking for. What it's good to know what their health conditions are to make sure that the medicine that they need is covered by the insurance, so that they're not in a situation where now they have to decide between, again, whether I eat or whether I take my medicine.
So, wow, that's a lot to take in. What we're going to do right now, we're going to go to a musical break. I am Angela Champ for Side Streets and Intersections here on IntellectualRadio.com. Stay tuned. Welcome back to Side Streets and Intersections here on IntellectualRadio.com. Once again, I want to remind you that on October 21st, 2016, I will be hosting my very first event that celebrates you. It's going to be at Durbin's Bar and Grill, located in Summit, Illinois. The information will be posted on the intellectualradio.com page as well as Facebook. I'll have flyers printed out and also word of mouth. And we're going to just come out, have a good time, do some networking. We're going to dance. We're going to eat. And we're just going to celebrate you because I think that it's very important to pay it forward. This opportunity was given to me by no other than Mr. Earl Winfrey, the other Winfrey, the producer. He's sitting right over there. He saw something in me several months back and came to me and gave me the opportunity to do what I do so passionately, and I actually really love it. So once again, thank you. Woo woo! Can I get a woo woo? So hopefully we can get a cameo appearance from Mr. Winfrey to come out to this event. He likes to stay behind the scenes. Well, anyway, also, and if you are looking for an opportunity to host your own show here at intellectualradio.com, please call 708-223-8953 because it's obvious that if you are hungry, you must be fed. So getting back to my special guest, she's also my friend, but she also does some other things in the community. You are part of which sorority?
Oh, it's Delta Psi Epsilon. Um, it's an organization where we believe in uplifting African American women of all ages and doing a lot of community service.
And you also sing in the choir. Actually, so for my listeners, I actually went and I stalked her page. She's my friend, so I can do that. But I actually stalked her page and she told me she could sing, but I also had the opportunity to really, you got some pipes. You got some pipes. Well, maybe we have to do a different show called KJ. She's so flawless, and have you do a number or something here. But getting back to the real serious issue, and that's health awareness in the African American community. Let me ask you this. You've been doing this for a while now. Are there ever times when you become so inundated with the scientific aspect that sometimes you may lose the human part, if that makes any sense? And how do you create a balance? Because it's a lot of information that you're taking in about many, many hundreds of different people.
Mm-hmm. Well, one of the things that I've told myself when I went through my medical training is that I always wanted to practice patient advocacy. For those who may not know what that exactly means, that means I always want to put myself in the shoes of the patient. So it's easy when you're on the opposite side of the spectrum to hear patients' concerns, complaints. Of course, you have to address their specific medical concerns, develop treatment plans, all that and the above. But I also wanted to make sure that I didn't become a robot and just hear, treat, hear, treat, hear, treat, hear, treat, which means hear what they have to say and then just treat. Hear. I wanted to make sure that I treated the entire person.
Holistically.
Exactly. I think sometimes when you are a healthcare provider, because you see so many patients, you hear so many different stories, and sometimes you see repetitive things that are common in certain communities and things of that nature with certain patients. It can be real easy to just kind of disassociate yourself from the patient and just treat the condition and keep it moving. Because, at the end of the day, we're human too. We have lives. And some providers have, kind of conditioned themselves to just treat and keep it moving. I myself, I think part of it's just my personality as well, is I'm a great listener. So I carry that into my practice. And again, I can't spend all day with one patient. So of course I have to, limit certain conversations and time limits, restraints. However, what I do, I'll tell a patient, hey, if you have 5 complaints, let's address 2 today. And then when I see you again, we'll address the other ones. That way, I'm not just making them feel as though their other complaints don't matter. It's just saying, hey, we don't have all time today to address everything, but we will get around to it. So the 2 most important ones we will address.
Now, I will say this, as a patient of hers, she gives optimum care. And I can honestly say that she was able to separate the friendship and do the job. And because even though we're friends, and sometimes that can be difficult assessing a friend, because sometimes you may have some information that may be somewhat disenchanting that you may have to um, share with the patient. But I can always say that you are always very professional. And I think that that's what allowed my respect and the friendship to grow and to remain as it has over the years. So let me ask you this. In the African American community, we understand that there we are deprived of many things in terms of accessibility. And so, what are some of the things that your organization that you're currently employed with? What are some outreach programs that you all do that would make the burden for African Americans just a little lighter?
Well, currently, right now, we're in actually, good thing you mentioned that we actually are in the process of trying to find better ways to get the information out there. One of the things that we do, we hand pamphlets out to patients to also give to family members who might need our particular type of care. As I mentioned before, I do home health medicine. So basically, my population of patients are to be geriatric patients who have some type of disability to, or some type of hardship, I should say, when leaving their home to go out. As we know, we live in a city where the weather can be up and down, back and forward. So when you're dealing with an elderly person who has, chronic arthritis of their hips and knees and have to use a cane or walker, it can be somewhat dangerous sometimes trying to get out to go to their own doctor or traveling back and forth in weather conditions. So that's where home healthcare medicine comes in, where we actually go to the patient in the comfort of their living quarters and still give them optimal, adequate medical care. So we do give out pamphlets. We'll inform them if they have other fellow friends or family members who also have difficulty with getting out to their primary doctor, or they have no transportation to go. That also I'm finding is a big problem in our community is that people just do not have access to transportation like they need to. Although we have a great transit system, however, it's getting to that transit system is a
Absolutely.
problem. They don't have the family members available to be able to take them. So what they do is they just hope and pray for the best. Take their medicine as long as they can, and if they run out and they're unable to get refills, then they'll tell me I just try to change my diet. They're trying to do things to still try to keep things under control. However, they just do not have the transportation to get where they can continue to have their blood pressure check, blood sugar check, cholesterol check, to do the checks for cardiac risk and things of that nature. So again, that's where we come in, where we're able to come to the patient. We'll let them know if you have other family members and they qualify for the service, we can see them as well. I can't tell you how many patients I've actually gotten from just word of mouth where the patients were satisfied with my medical care treatment for them, and they referred other friends to my service who actually come find out they haven't been to doctors in years.
So let me ask you this. First of all, where is your organization located so that, because you can always use more and more patients, where is your organization located? And just talk about that so that for those that do have accessibility, they can come on over if they're looking to switch. Not that I'm trying to take anyone's business. Let me put that out there. However, I'd like for people to know where they can come and seek your services.
Okay. My medical practice is actually located in Oak Brook Terrace, Illinois, 17 West 200 in Oak Brook. Again, we are home health practice, so we don't have patients come to us. We go to the patient. As long as the patient has Medicare coverage, specifically Part B, then their insurance should cover the service.
So, can you just kind of differentiate the Plan B from the Plan A, what that means in layman's terms for people that really don't understand that?
So if you look at your Medicare card, the red, white, and blue card, you'll see where I have Part A, Part B. Part A is hospital, which means that you have coverage for hospital stay. Part B is office coverage. So that means going to the doctor's office, or also includes home health care coverage, where it's nurses, physical therapists come to the home, occupational therapists come to the home, dietitians. Part B usually covers that. So if you only carry Part A, then you might find yourself having some difficulty with, adequate coverage for other medical treatment outside of a hospital. But I believe most patients usually sign up for Part A, Part B. So as long as you have Part B, that covers me.
So, let me ask you this. What are some of the common themes you see in the African American community, particularly with illnesses? What are some of the common themes and things and or ways that can be modified so that it doesn't have such an adverse impact on one's life? But what are some of the common themes you see, particularly in the African and Latino community?
Well, of course, high blood pressure is a very common disease process that we see. Diabetes definitely is. And in fact, the most recent study that I've seen is saying that probably about 80% of the African American community is diabetic, and probably more than half of that are not even aware.
Wow. So, when you talk about diabetes, can you talk about the different types of diabetes? Because a person says, "Oh, I'm pre-diabetic." What does that actually mean?
Actually, pre-diabetes was a term many years ago that was derived where through blood work we would see that a person was consistently having elevation of their blood sugar, but it wasn't classically high enough to say, oh, you are a diabetic. I would probably say about 5, 6 years ago, um, the American Diabetic Association actually had dismissed the term prediabetes.
Okay.
However, people are still using it, healthcare professionals still use it, but they got rid of the diagnosis of prediabetes, and the reason is at this point either you're diabetic or you're not.
Absolutely.
I heard one colleague kind of put it like either you're pregnant or you're not. You can't be pre-pregnant.
Absolutely.
Either you're pregnant or you're not pregnant.
Absolutely.
So that's kind of how they view diabetes. Either you're a diabetic or you're not a diabetic. So at this point, I rarely, if ever, use the term pre-diabetes. What I will tell a patient is if through their blood work, I'm finding that their numbers over time has begun to increase, I would tell them you are on the road of being a diabetic, and if we don't intervene now, you will be either on medication or we will be trying to find some other kind of treatment plan. So I don't, like I said, I don't use the word pre-diabetes. I would just say, hey, you're on the road, and if within the next couple of months I'm checking your sugars, if things are not changing, then we're going to have to start talking about other treatment plans if your diet and exercise alone is not bringing your sugars under control.
Wow. It's just interesting. It's interesting when you have a friend that's in the medical field and, we're friends, but then when we talk and we sit down and we talk, and let me just tell you, like, when we're hanging out, we don't talk medicine. We talk about everything but medicine, because I think that in order to create a balance, you don't want to bombard the person with asking all this free information that otherwise I would have to pay for. So I just want to say that I think that what you're doing is amazing. I think that everyone doesn't have the stomach to do what you do, because there are many things that you have to attribute to healthcare, patient healthcare. Particularly, yeah, we know about bedside manner. That is utmost. But you also have to have the stomach for sometimes the unknown and unforeseen.
Mm-hmm.
And how do you deal with that?
I've had people ask me that before, and I think it's just I've never really viewed medicine as a scary thing. I just viewed it as you only have one life to live. I tell my patients all the time, you have one life, you have one body. So it's up to you to decide how you want to use it. So I tell them, hey, you do what you can do as much as you can do, and you leave the rest in God's hands.
Absolutely. Now, it's funny that you say that, because oftentimes people that are in medicine are atheists. So let's I don't want to tread too much, but how do you bring science and religion together? Because we've been taught that they're not together; they should be separate entities. So how do you bring those together and make it make sense?
Well, if we were speaking specifically about African American community, as we know, a lot of African Americans are rooted in God, and they're rooted in whatever particular religion that they are based with, and they know that above themselves there is someone else who's looking out for them. So it's not actually, truthfully, not very difficult to somewhat bring the two together. In fact, I've had patients, testify to me about the goodness of God when it came to their health. The doctor said no, but God said yes. So it's not difficult to do it. Of course, I'm also not there to preach as well, and I'm not there to pass judgment. So when a patient wants to discuss with me, or where the doctor said that this is the reason why, but I know that this was nothing but God, I'll tell you absolutely right. Because medicine, God has allowed us to utilize our knowledge and our hands to carry out his plan. And that's really what it is. So if God sees fit and man says no, we know who's going to supersede that.
Amen to that. Amen to that. Now, interesting. When guests come on my show, I am usually, as we are all assessing one another, but I'm usually assessing the guest because I'm looking into your eyes, and as you begin to speak, there is a spark. So it lets me know that you're very, very passionate, not just from a theoretical standpoint, but from a real world setting, and that what you do it with a sense of being and understanding that you were given not just a particular skill set, but and or a gift to share with the world. And so through that, that is your testimony. You're able to testify that way.
Mhm.
And I just want to say that this time is passing. We're going to take a quick musical break and then we're going to come back with some final thoughts and comments on this subject. I am Angela Champ for Side Streets and Intersections here on IntellectualRadio.com. Welcome back to our final segment of health awareness in the African American community. I am your host, Angela Champ, here on Side Streets and Intersections for IntellectualRadio.com. And in the studio with me is a friend of mine, is also a healthcare professional, Miss Camila James. I actually like that name. I really wish that name was kind of mine. No. I'm okay. I'm okay with Angela. So we're going to begin to wrap this up with some final thoughts. What are some of the things, once again, where can they access you? And what are some of the final things, some final thoughts that you would like to put out there for those that are listening and or viewing this show on this evening?
Again, my office is located in Oakbrook Terrace, 17 West 200. Oakbrook Terrace, again, is a home health practice where we actually go into the community to see patients anywhere in the Chicagoland area. So if you do have family members or loved ones or friends who you're finding they're having more and more difficulty, whether it's because of medical concerns or lack of transportation, or even just because of age, they're having more difficulty with getting out of their home and or leaving, then they can be a candidate for home health care medicine. Of course, with insurance plans, Medicare Part B, if they have Medicare Part B, then they should be covered for pretty much most of the home health care services that they might need. So, with Angela asking some final thoughts regarding healthcare and each individual, one thing I will say is that a lot of people don't want to believe it, but lifestyle and how you live your life does play a role in your health. I know a lot of people, I say this, we live in a society where they kind of tell you, do what it is that you want to do. And there really isn't any consequences behind it. Whatever feels good to you, whatever feels right to you, just do it. Well, you have to know and understand that you can do that, but there are consequences that you can't possibly pay. And one of them could be your body, your health, or your life. As we know, especially the segments about an African American community, but in really any community, how you live your life, your diet, exercise, indulging in certain activities such as smoking, alcohol, substance abuse, these things will take a toll on you. Each person is different. I hear commonly, oh, well, my grandmother smoked till she was about 90 and she lived. But what grandma did doesn't, and how she lived and the many years she lived despite her smoking doesn't mean that that would be the same for you.
Absolutely.
And then there's also other things like being aware of your genetics, being aware of what is passed down through your bloodline. That's important as well, because there are some disease processes that even if you did all the right things, you could be genetically predisposed.
Absolutely.
So knowing your family history is very important as well.
I just want to say thank you. We will have to do another segment when you are not on the road jet setting somewhere and or doing what you do best, and that is taking care of our people in our community. Once again, I want to thank you, Camila James, for being here on Side Streets and Intersections on IntellectualRadio.com. We are an iHeartRadio station. Until next week, if you are not being fed, it's because you are hungry. Therefore, you need to tune into Side Streets and Intersections here on IntellectualRadio.com.